Majo John Madden Juanito and Parque Acamal in the little pueblo of Acamal, Mexico in the Riviera Maya. Beautiful Mexican flag blowing in the breeze. This is a wonderful park and I spend a lot of time here. I just outside of this park did a little short video in which I boldly claimed that medical care and dental care are much better in Mexico than in the US. What I mean by that is that it's way more affordable, much more utilized by people when they need it, whereas poor people in the US, lots of luck getting medical and dental care. When I was in Progreso, Texas, right across the border from Nuevo Progreso, Mexico, there was a steady stream of Latino and Anglo people from the US crossing over to get their medical and dental care, and that happens all through Mexico. Medical tourism is a big business here. Mostly it's more affordable because insurance companies mostly are not a player, drug companies are not a player. Folks in the US feel like they get better medical care because they have lots more doctor visits, lots more specialists, lots more hospitalizations, take lots more drugs, and spend a much bigger percentage of their annual budget, even if they have good insurance. Insurance in Mexico can get you into a better hospital. I don't have any, and I did a lot of doctoring at the big Hospital General, the big poor person's hospital in Veracruz, and the doctors were super. I got great care. And I also had done a lot of doctoring at the famous Cook County Hospital in Chicago, which is the poor person's hospital. It's the hospital where lots of doctors like to train in the ER because they get to see everything. The big difference? That hospital also, the medical specialists, the phlebotomists, all the professionals were awesome and devoted to patients. But the frontline staff were dismissive and rude and didn't like having to work with poor people. Ooh. Whereas the frontline staff in Veracruz were fabulous. They were Latinos in the Latino culture, and they don't know how to not be nice. You see lots more young and old, especially young women in Mexico with braces because they can afford them. And if their smile is slightly imperfect, they want to do something about it. So lots of braces in Mexico and lots of eyeglasses. I'm sure that if research was done, much greater percentage of Mexicans wear eyeglasses, not because their eyes are weaker, but because they can afford glasses. And that little less than 1 minute short I just shot, there's an optical clinic set up just outside the park all day, probably free or very cheap. I got my 4th COVID booster in Las Trancas outside of Jalapa a year ago. And it was just set up on the street corner. I had no ID with me that day. No problem. It was free. Yeah, it's a better place for medical and dental.